One of the things I'd like to focus on is the treatment of ACL ruptures. This is the commonest sports knee injury that we see within the knee, and we see it a lot in elite athletes such as football players, rugby players, tennis players, and in particular skiers, particularly in the winter time. The ACL is essentially a rope that holds two bones together. It's a very strong ligament in the knee. Unfortunately, once it ruptures, it's not got a very good blood supply. So once it's torn, that tends to be it's torn forever. It's very rare that you get a partial tear. So the majority of patients do have chronic instability within the knee, where they feel like the knee just keeps giving way. The ACL is supportive for pivoting movements. So if you're going back to pivoting sports, you might notice a lot of instability within the knee. Linear sports tend to be okay, such as cycling, swimming, jogging on a flat surface. As ACL ruptures are very debilitating to very healthy people, most of the patients I see end up going forward with an ACL reconstructive surgery. The way we carry this out is through a very minimally invasive technique, and we try and get you up and about as quickly as possible and back to the activities you want to do as comfortably as possible. When the ACL ligament tears, unfortunately the two ends are very shredded, so we can't stitch it back together. So now with modern techniques, we actually use some of your own tendons around the knee to create a new ligament. The commonest one that we use is your hamstring tendon. You've got a lot of hamstring tendons. We don't touch the main hamstring tendons that lead to a lot of the strength. We take some of the accessory tendons that grow back. The ACL that we make is actually stronger than your original ACL, believe it or not. So you're up and about walking, fully weight bearing that day. What you can expect on the day of your procedure, you'll come in the morning, you'll see me as your surgeon, and you'll also see the anaesthetist as well, and the nurses will get you ready. We take you down to the operating theatre, and the procedure is usually done under a general anaesthetic. We put a lot of local anaesthetic around the knee, so you're very comfortable afterwards when you wake up. We get you back to your suite, have a bite to eat, and the physiotherapist gets you up and about straight away. Now, there are always risks with every surgery, and the risks included with ACL reconstructive surgery are things like infection, blood clots within the legs, and stiffness as well. That's why we push you quite hard, quite quickly with the physiotherapy team to get you going as quickly as possible. These risks, I have to say, are very rare. They're way less than 1%. Probably even less than 0.5%, as we do keep a close eye on you, but we just make sure that everything's heading in the right direction, and we see you regularly in clinic until you're back to doing the things you enjoy doing. So you'll need crutches, painkillers, physiotherapy, but we try and get you on an exercise bike, get you at the gym within about a couple of weeks' time. We find that patients do get back to their elite sports, but it can take anywhere up to 9 months to get full rehabilitation to go back to a competitive match of football or of rugby. If there's a less pivoting sport, we can certainly get you back a lot sooner. A lot of the times when patients have had ACL ruptures, they've damaged other aspects in their knee as well, such as the meniscus, which is a rubber C-shaped shock-absorbing disc within the knee, or one of the other ligaments as well. During the procedure, we've got everything ready. There's no surprises. So even if the scans didn't pick something up, we'll have a good look around your entire knee, and anything that we find, we can fix it then and there. So in summary, ACL ruptures can be very debilitating to the healthiest of people. We undergo rapid rehabilitation. We get everything done and treated in one sitting, and we aim to get you back to your sports at a pre-injury level.